Type 2 diabetes is when your body is producing insulin, but it's not controlling it well enough. So, or if it's not producing enough insulin. So then you have to take, of course, either medications or insulin itself to try to help the body with the insulin that it is producing, or to help it produce even more, to get your blood sugar at the desired level. My first interaction is how they are controlling their diabetes, what are they doing, how their diet is, if they're exercising, because those are the two major things that will impact a person's blood sugar and how they can control it, even on pills or on insulin. It's very important that they do have some sort of a diet plan that they're on, that they're watching what they eat. So my interaction with patients over time, as I develop the relationship with them, changes as I will begin to see, and they will begin to see, the difference in where they came. If they came in with blood sugar readings of 3, 4, 500s, and now they're coming in with 100s, 200s, they get to see the difference. They'll feel the difference, and then I become more of an encourager, a motivator at that point to continue doing what they're doing as they continue to take their medications on a regular basis. Encourage more of the healthy eating, encourage more exercise implementation, and also begin to see their weight begin to drop as well. It becomes more of an encouragement to them to see what they're doing, what have they done themselves, if they are taking an active role in managing their diabetes, make sure that they are taking their medications in a timely manner on a daily basis, if they're monitoring it with the glucometer, checking their blood sugar on a regular basis, and to see if they've actually implemented some kind of diet and exercise as their weight continues to drop, to encourage them to keep going and what they're doing, and so they can see the difference in themselves and also feel the difference. I pretty much, well, we do, besides like the basic triage, checking their blood sugar, checking their blood pressure, because it also correlates with diabetes. I check their feet to see how they're managing the care of their feet, that there's no open sores, no ulcers, anything like that. And that's pretty much it, other than just seeing what their history has been with their blood sugar. I think that the major misconception is that it only happens to obese patients. You do not have to be obese to have type 2 diabetes, which is formerly called adult onset diabetes. Just in what you're doing, if it's hereditary, you know, whether you're big or small, you know, you can get type 2 diabetes. So I think that is the biggest misconception. So if I work with someone that's having trouble following their diabetes plan, I pretty much encourage them kind of weighing the pros and cons, the pros of eating healthy, of exercising, having a more active lifestyle, the medication, especially for somebody that could be on insulin, that the insulin is temporary. So if you implement the right diet, implement the exercise, that you can come off of the insulin, and you'll just have a better lifestyle outlook on life, versus if you keep your diabetes not in control, you may risk having vision problems, heart problems, the whole 9 yards. I think it's important for children and adolescents to learn about type 2 diabetes, because type 2 diabetes is occurring more in children and adolescents. I think with their mindset that because they're young, that they don't have to worry about the health problems that adults do. But in actuality, as it is occurring more in children and adolescents, they can have the same risks and the same problems. And so if they're educated about it now, they're able to prevent those things in the future by watching what they eat, maintaining a healthy diet, that they're exercising, will help prevent those things in the long run. I think kids and teenagers should learn about type 2 diabetes because type 2 diabetes is occurring more in the children and adolescents nowadays. And I think because they're young, that they don't have to worry about these things that their parents are going through, when in actuality you can't eat everything that you want, you know, which I think is why schools are stressing, you know, eating healthy, exercising, stuff like that. And it's important so they know, because you can get it at a young age as well, and it will affect you in the same way that it does affect an adult, your parents, your grandparents. What I like best about being a medical assistant is being a part of making a difference in people's lives, being able to encourage them, being able to inspire them, being able to motivate them to want to do better, want to have a healthier lifestyle, and to be able to have the resources for them to do so. So the patients that I work with are both young adults and older geriatric age patients with diabetes, some that aren't diagnosed until their 50s, 60s, and so we help them to begin to manage their care. So the other health professionals I work with would be dietitians, nutritionists, of course the nurses, doctors, social worker, pharmacists as well. We are a big team that can help bring together any questions that they have, help them to motivate them to manage their diabetes. A routine day for me on the job would be vitalizing the patient, checking their blood pressure, blood sugar, reviewing their medications, seeing if they need any refills on any of their medications, checking to see if lab work, any radiology reports needed to be collected for the doctor to review with the patient, and then putting the patient into the room to see the doctor. Also, scheduling appointments, scheduling follow-up appointments, calling to confirm appointments for the patients, retrieving medical records from outside facilities as well. I initially became interested in becoming a medical assistant. It was kind of my way of entry into the medical field, once wanting to become a pediatrician, and kind of downgraded to start a foundation by becoming a medical assistant to get more of the hands-on training into the medical field, and at the same time kind of learn and develop my skills as I grow in the nursing field. I think the talents and abilities that I bring to the medical assistant, especially in the department that I work in, is the fact that I am bilingual, both English and Spanish, which is very important in the diabetes field, because as our minority are the main, have the highest of diabetics, being able to speak to them in both Spanish as well as the English-speaking patients is a very important factor. My customer service skills, I love working with people. I have a knack for working with people, so I really enjoy that, and that kind of puts the pride in what I do. It allows me to have more pride in what I do, because I love working with people and, again, love seeing the difference in people's lives. The training that I needed to become a medical assistant was just technical school. I attended, you have some 9-month programs, some year programs, depending on where you go to become a medical assistant. And then from there, it's on-job training. You do an externship in the clinic that you choose. And so I was fortunate enough to do my externship, was hired with the same company that I did my externship, and began my training from there. From what I know, the starting salary for a medical assistant is around $10 plus an hour, depending on where you're looking to work. So, the average is about $10 an hour. I have a personal interaction with someone impacting their life on two ends. One, I have a mother who is diabetic, and seeing the change in her as she began to implement her taking her medication the way she's supposed to, and also with another patient whose blood sugars were very out of control, and it was hard in the first few months of working